Literature suggests three types of risk communications. You have something called precautionary advocacy, where you tell the people, watch out, something terrible is going to come your way. Or you could have outrage management, which is calm down, you provide reassurance. Or you have crisis communications, where you give people confidence by saying we will get through the crisis together. You guide people. Now, some of the challenges we faced, one was to prepare the public for possible deaths from H1N1 without creating mass panic. So I think by the second press conference, the minister was saying the probabilities were there. It was almost unavoidable. We had a lot of confusion arising from the WHO announcements. So you can see what happened in Singapore. On 28th April, we raised the alert from green to yellow. 2 days later, from yellow to orange. But this was also in concert with WHO. But by 11th May, when the severity was clearly not evident, from orange back to yellow. Now this looks good on paper, but it created enormous confusion in all the government ministries, organizations, and agencies, because they had to manage the change of instructions, getting public to understand why it was okay yesterday, it's not okay the following day, and then it's okay again the third day. Communications process became rather complicated. We had other problems also, some of the lessons from SARS. We had a case where one of our national museums refused entry to a doctor for fear that he had been handling sick patients. This happened during SARS, and the lessons from SARS were so imprinted on people's mind that they behaved SARS-like. Some of the measures for SARS became duplicated without our knowing. And we were not conscious. Of course, now we are very well aware that people have these mindsets. So medical officers, medical healthcare workers were not allowed into a public facility. Schools were told to quarantine students. Again, you can put out wonderful communications messages, but sometimes on the ground it's a lot more difficult. When we said we had to quarantine students returning from overseas, schools, one school principal caught me by the collar and threatened me. He said, you know, these silly characters up there, you make all these wonderful press releases, but do you have any idea of the implications of your message? Many of our schools have over 100 to 200 students from China and India. They had gone off for holidays in June. When they returned, the schools were told you have to quarantine them. But quarantine implies huge allocation of resources. You have to have doctors available, you have to have staff on cruise ships, you have to have teachers checking on the students, you have the building to be secure, blah, blah, blah. So, between the message and the implementation, a lot more work had to be done. We also had some contradictory information. We were advising the public to avoid crowded places. We were telling people to avoid crowded places, don't go to theaters and so on. At the same time, we were hosting the Asian Youth Games. We were also celebrating 44 years of national independence, and we had the National Day celebrations in huge crowds, 50 to 60,000. So there were contradictions in the messaging that we were putting across, because there were higher intentions. And also we had very targeted control measures. For instance, only certain schools were closed, and this was also the subject of considerable debate. We did conduct regular surveys to ensure that we were reaching out to an audience. This is something we learned from SARS, that you can put out all these fancy messages and press releases, but you have to be sure that your public actually understands what you are trying to tell them. And so we did regular weekly polls to see whether, one, the public understood the messages, and two, whether they felt reassured, whether there were areas that they felt there were lapses in our communications. 98% agreed that Singapore was timely in updating, the government was timely in updating citizens. 2 out of 3 were happy with the precautionary messages we have a problem in Singapore, I'll admit it up front. If you ask a Singaporean a question in a survey, he sometimes tells you what you want to hear. So you would have to discount about maybe 15 to 20%. Formal survey was conducted in late 09, also showed significant levels of concern, with a drop in numbers not worried, coinciding with the increase in the number of deaths in Singapore from H1N1. When I left Singapore, we had our 19th fatality. So we've had 19 deaths from H1N1. But significant numbers retained confidence in government measures, and a large majority felt the government provided adequate or too much information. And these surveys conducted throughout the crisis helped to give us a sense of public concerns and attitudes. So, for instance, during SARS, we conducted a survey where we found a number of our older Singaporeans who only spoke in Mandarin, didn't quite understand your messages, and we had to make changes to allow a dialect policy that allowed us to reach just that category of Singaporeans at that age bracket. Some very simple points. We need to acknowledge that public health cannot always be managed solely by the Ministry of Health in any one country. It really requires a multidisciplinary approach. It is also a global public good that requires meaningful interstate cooperation. And given that Southeast Asia or China will likely be the epicenter of any outbreak, we also need to be proactive. Again, some very common sense points been made by some of the other speakers. I suppose, did we overreact? Did Singapore overreact? Many Singaporeans think so. But we think risk is inevitable. When you come down to it, people expect governments to protect them completely from all risk in their daily lives. We all know it's impossible, so there will always be a trade-off. Our position, and I think we have taken it very carefully, is that it is always better to err on the side of overreaction than underreaction. Perhaps it's because we are a very small state, perhaps. I think during SARS, for instance, one of our ministers, Mr. Lee, made a remark which I thought was good. He said, don't worry too much about the public relations. Don't worry about criticisms about other countries, about Singapore. Just focus on saving lives and contain the disease. And the public relations will sort itself out after. I thought it was wise advice. Essentially, it requires a tough decision, usually by a core of leaders. In Singapore, is managed by the Minister for Health, reporting to the 7 ministers in the Homefront Crisis Committee. And fear can be a constructive emotion. When people worry about a risk, they pay more attention to it and take action where necessary. Soft warnings and reassurances don't work. But of course, at the other end, unreasonable fear can also be unhealthy, maybe conceited. Maybe now that Singaporeans are all indifferent, we better do something about it. Come up with something much more stronger. Criticisms, again, I've just taken a few of the major criticisms that I've been able to find in the literature. There are many more. WHO had advised against travel restrictions very early in the day. The quarantine measures and travel restrictions used during SARS that we instituted for H1N1 and also a number of other countries, I think Australia, Japan in the initial period, were criticized as pointless and a waste of resources. Now, of course, the use of thermal scanners has been dismissed by many. There are enough articles in enough journals dismissing the use of thermal scanners, and in particular for H1N1, where you don't show any symptoms. You're not febrile when you come through the airport. The imposition of drastic social distancing measures in Mexico, for instance, and other countries incurred costs. Countries were reluctant and hesitant to switch from containment to mitigation-oriented strategy. And the mixed signals from WHO perhaps exposed some loopholes in WHO's pandemic alert system. And perhaps, according to the literature as mentioned, exploited by some governments to pursue their own political agenda. But you know, our thermal scanners actually picked up 25% of return travelers with H1N1. The rest probably slipped in with no symptoms. So I think the it's still, the debate is still there, whether you want to use it or not.